Today we're diving into spondylolisthesis, or sometimes called a spondy, and how we can tackle it without surgery. Hello there, I'm Dr. Paul Fisher, a chiropractor based in Downers Grove, Illinois, and if you're new to the term, spondylolisthesis is when one vertebra or bone in your back slides forward and sometimes backward over the one below it, causing pain and maybe even the fear of surgery. For years, people thought surgery was the only way to fix this, with other treatments just preventing it from getting worse. If you're watching this because you're desperate to avoid surgery and find relief, I've got great news. In my office, we've corrected spondies, helping patients get significant relief. Let me show you a pre and post x-ray from one of my patients. So this is one of my patients. We can see is that actually this bone has slid backward here. Now, after treatment, you see how everything's in a line here. This gentleman was actually an amateur weightlifter, and throughout care, he was able to improve his max by about 30 or 40 pounds with no other change in his training as well. Guy did great. It was wonderful to have in the office. I use a technique called Chiropractic BioPhysics, or CBP, and I'm one of only a few hundred advanced certified CBP chiropractors across the nation. My success with spondylolisthesis isn't unique. My colleagues are seeing similar results. While we chiropractors are great at treating patients, we're not always the best at publishing our outcomes, but the research is catching up. Let's break down what spondylolisthesis is all about. This is what normal bones in your back should look like. They're all lined up here. Everything is in a line. Nerves would come out of these holes right here. Now, in a spondylolisthesis, what this will look like is one bone has slid forward. Typically, this is due to a fracture here in this part of the bone called the pars. Now, what will happen is this will create pain, and it can also cause problems with the nerves coming out of here. These are what the bones look like more or less in real life, not like an x-ray. The most common causes of spondylolisthesis are stress fractures from repeated hyperextension. Think bending backward like a gymnast or compression under a load like a football hit. Another cause is degenerative. Many people think degeneration is a sign of aging, but what we're learning increasingly is that degeneration is more a function of abnormal biomechanics to an area in the spine. I've seen patients in their 50s with necks look much better than patients in their 20s who had terrible degeneration. It makes sense when you think about it. If it was only due to aging, it would be the same throughout the spine, but it's primarily in areas where the alignment or biomechanics is abnormal. Back to spondies. In my office, after seeing thousands of patients, I've noticed a pattern. If a woman in her 20s comes in with chronic low back pain and only gets temporary relief regardless of what treatment she's tried, and it has a history of gymnastics or cheerleading, about half have a spondy. To be clear, I'm not saying 50% of women in these sports have one. What I've seen is that women who've been in these sports and have low back pain in their 20s, good chance there's a spondy. It seems to affect women more than men because of their increased flexibility. Thinking back to that slipped vertebrae, you can see why this causes pain and problems. So how do we treat this? In my office, we've seen real improvements, but you might be skeptical, thinking it's a fluke. That's where the research comes in. A 2017 study in the Journal of Radiology Case Reports showed a 69-year-old woman with a grade 2 spondy. Her vertebra was 13.3 millimeters out of place. That's half an inch. After 60 CBP sessions, it was down to 2.4 millimeters, less than a tenth of an inch, and her leg pain was gone. That's exactly what we're seeing in our office, and it's a kind of relief you could get too. A 2023 case series showed patients with spondylolisthesis had less pain, better quality of life, and fewer issues like bladder problems. There's currently a larger study of over 500 patients in review showing these same results with improvement in spondylolisthesis. What may be interesting to those of you with kids, a 2021 study showed catching a spondy early with x-rays can prevent bigger issues, even in kids, meaning less pain, fewer surgery talks down the road. This is huge for kids in activities like gymnastics, cheerleading, or football. In my clinic, I'm helping patients like you avoid the path of chronic pain, dysfunction, and surgery. With CBP, we're not just covering up pain, we're fixing the root cause so you can live freely again. CBP is different from traditional chiropractic you might know, with adjustments, exercises, decompression, or other treatments to boost healing and reduce pain. Those are great, but for spondylolisthesis, they're often not enough. So what we see in this patient is another classic example of a spondylolisthesis. You see how this vertebrae is slid forward on this. This is the most common presentation we see. The L5 vertebrae, due to that fracture right here, you notice that lucency, that lightness, compared to there where it's white across, has caused that sliding down there. Now, this is a patient who'd been going to chiropractors for years. He'd been getting decompression, adjustments, other treatment. He'd felt temporary relief, but his symptoms kept coming back. Back pain, leg pain, weakness in his legs. Now, looking at that forward slide right here on that vertebrae, decompression alone won't fix that. And that's also why we have to look at the whole spine, not just the painful area. His back is shifted back, causing his mid-back curve to curve more than it should. Here, this is a hyperkyphosis of the thoracic spine. Too much of a curve, or you think if you're being hunched over too much. This next patient has been dealing with back pain for years, and while he's gotten temporary relief, episodes are getting more frequent and severe. So what we see here is that this bone is sliding forward on the one beneath it, giving the characteristic spondylolisthesis. Do you notice these two up here that have slid back? If so, good work. Again, we have to look at the full spine. We see here as a normal, everything lined up vertically. So we see here this patient, their spine is leaned forward. This is going to create a stress point, and unless we address the entire spine, this is going to keep getting worse. Another reason too that you've got to look at the whole body, not just the area where the pain is at. So what do? How do we address this? CBP is the missing piece in understanding how your spine should work and look. These patients were just like you, scared of surgery, desperate for relief, and now they're thriving. You can be too. So how does it work? We start with a detailed history of your condition, an exam to check how your body's moving, and test for neurological issues. X-rays in-house if you don't have recent films, possibly MRIs. Based on those findings, we create a personalized plan that might include adjustments, mirror image exercises, traction, laser therapy, or shockwave therapy. Most importantly, we take a stress film to see what type of correction, if any, we can expect. Sometimes there are cases we can't help, and I'll be upfront about that too. I know surgery can feel like your only option, but it isn't. Published studies show the type of care we provide here can reduce slippage and ease symptoms without going under the knife. My patients are walking away from surgery fears and toward relief, and I'm here to help you do the same. We can get your spine back in line and you back to you love, whether it's playing with your kids, hitting the gym, or just sitting without pain. Come to my clinic. Let's get those x-rays and start your journey towards relief. Want to learn more about CBP? Check out cbpnonprofit.com or book with me if you're local. That's how we beat spondylolisthesis without surgery. If you're ready to ditch the pain and surgery fears, hit that like button, share with anyone stressing about their spine, and drop a comment. Tell me about your pain or surgery worries. Subscribe for more spine-saving tips, and check the description for links to studies and how to book with me. Let's keep your spine strong and your worries gone. Thank you for watching, and hope this helped.